and I'll be presenting on National Athletic Trainers Association position statement, Preventing, Detecting, and Managing Disordered Eating in Athletes. The objective is to present recommendations for the prevention, detection, and comprehensive management of disordered eating in athletes. Certified athletic trainers have a unique relationship with athletes due to their frequent daily interactions with them. The time spent means that they are very influential in detecting disordered eating in athletes and working with them to manage this condition. This affliction puts the athletes in psychological and physiological harm that can be fatal. These athletes rarely self-report symptoms, tend to deny the condition, and often resist treatment, thus making the skills to prevent, detect, and manage disordered eating very important. In athletes, the pressure of increased physiological training can create disordered eating, defined as a range of restricted eating and weight control. These practices are usually a result of concerns about body weight and shape, poor nutrition, or decreased caloric intake, binge eating, use of laxatives, diuretics, and diet pills, and fasting, vomiting, and excessive exercise. Estimate of prevalence in athletes are 62% in females and 33% in male athletes. With such high numbers, better preparation for personnel that work with athletes needs to be done to understand the challenges of working with athletes who may be at risk. The National Athletic Training Association designed guidelines to help certified athletic trainers that have cases of disordered eating in their athletes. For immediate action, the athletic program needs to identify a readily accessible team of qualified caregivers with requisite training for detection, treatment, and necessary alternatives for assistance. Within this team, there should be a management protocol with policies and procedures dealing with disordered eating. An established screening approach will help identify signs and symptoms. There will be a wide range of people that will be working with the athletes, some with more knowledge of disorders than others. This group should develop and define policies of the appropriate response of coaches when dealing with body image and performance. Coaches should not be the appropriate weight management protocols, should not determine the appropriate weight management protocols within their team. Working along this policy, mandatory educational and behavioral programs should be implemented for the athlete and personnel working with the athletes. Early detection should be a high priority in athletic programs. There are continuums of severity which can progress into 3 clinically diagnosed conditions: anorexia nervosa, bulimic nervosa, and eating disorders not specified. To help identify a disorder, attention needs to be directed in changes to the athlete's most common behavioral and psychological characteristics. Signs and symptoms should be detected early because medical complications can come about from the malnutrition and purging of the disorder and can detrimentally affect the health of the athlete or be fatal from this physiological instability. The female anatomy is a very sensitive system. Female athletes that are living with disordered eating can harm their reproductive system due to low energy available to carry out a menstrual cycle, which can create amenorrhea and bone mineral disorders related to the female athletic triad. Physically active girls that participate in a wide variety of sports should be monitored for these conditions. Even though males don't present the same diagnostic characteristics, equal attention should be paid to those that exhibit signs and symptoms. There are a lot more commonalities than differences in disordered eating in males and females. However, it's harder to openly discuss eating problems with male patients because there are negative feelings of embarrassment and shame because these disorders are associated as female disorders. Similar strategies should be used to treat these athletes. There are speculations that there are only certain types of sports that need more attention than others for at-risk athletes. However, there should be high suspicion in all types of sports. The sport may not require a specific body type, but the athlete's perception could be altered for what is required for optimal performance. Athletes rarely come forth due to denial and shame. Specific questions should be asked during the pre-participation exam about medical history to detect any pre-existing signs or symptoms. If suspicion arises from the history An interview by the healthcare team should follow for more accurate interpretations. The personnel that work with the athlete should become skilled observers of the athlete's behaviors. If they change or seem suspicious, this is the quickest way to detect disordered eating. If a disorder is suspected, the initial intervention should be facilitated by an authority figure that is in good terms with the athlete. The athlete should be first approached with sensitivity and respect and told what observations have brought concern. The person confronting the athlete should expect resistance, anger, or denial from the patient, but have expertise readily available for consultation. If the disorder is confirmed, the athlete should be referred to a physician for evaluation and tests to determine the severity of the disorder. A treatment plan should be put into place that includes nutritional supervision, medical supervision, and a supportive environment to promote recovery. There may need to be therapeutic interventions such as registered dietitian. Exercise and participation may need to be limited until the problem is controlled and the athlete is back to normal health. Maintenance care is required to prevent relapses. Education is the best way to prevent disordered eating. Discussion that is open and truthful will help the conversation and knowledge of a disorder because there is fear associated with talking about the problem. Athletes should be taught about the correct nutritional practices so they are able to decipher correct eating habits that ensure adequate energy availability from wrong eating habits. Interventions and knowledge are important while working with athletes who are at risk of disordered eating. There are ways of managing disordered eating and handling it before it becomes detrimental. The personnel working with athletes just have to be prepared for the situation when it arises, and that are prevention, management, and treatment ways of dealing with athletes with disordered eating. Thanks for watching.